What's going on, guys? Welcome back to W.D.Y.D CSP with the W.D.Y.D as a central sterile processor. Alright guys, join me as I reassemble this Pectus tray. I had already did this tray and then thought, man, maybe it's a good idea to do a video on this tray because this isn't a very commonly seen instrument, right? Or in very facility instrument tray in many facilities. So these are the templates. This is what's used to size up the patient, right? Or size up the area in order to place the implants. Now this is being placed into the patient and then placed right back into the tray, right? This isn't going to get discarded at points of use. So this should come out of its holders, inspected for any kind of damage, cleanliness, and things of that nature, right? And functionality. Now these are malleable, so bending it back and forth a couple times, you're going to see some creases in there. What you don't want to see is any breaks or any tears or any damage to those templates. If you start seeing them that they look like they're going to break in half or in pieces, they should be removed and replaced. Okay, the implants themselves should never make their way back into the tray if they touch the patient, right? They were used during surgery. So these typically stay in its holders, right? You don't remove them for cleaning. You just kind of leave them in its holders. So even though there's not a lot of them, you can take them out and actually inspect each one of them. But if you ever come across one that looks like it's damaged or used, that should be reported out to the OR because these are single-use devices, right? So I'm just confirming that I have the right sizes and the right quantity of what it said in my count sheet there. So these are pretty easy because the tray itself is like a shadow board, so it'll tell you which size goes where. Okay, indicators are already placed inside the tray, so that's taken care of. The instruments were taken out of the tray. Okay, I'm doing some inspecting now. I see like a little blemish there, and I'm trying to wipe it off to see if it comes off. It's not coming off, but you know, that can be from, you know, these are matted instruments. Matted instruments do have the tendency to stain sometimes or hold on to any kind of water spotting more than the mirror finish instruments. Also, prior to this video, I should have did it on screen actually, is I took some instrument tape off of some of these instruments that was pretty beat up. So it could have been some adhesive or some when the sterilizer sterilized the actual tape, it actually transferred onto the container. I'm just making sure with a quality test. This is a soil test here, making sure that there's not any kind of soil that, you know, can compromise sterility or patient safety, and they both came back negative, so I'm good. All right, testing these instruments out, checking them out for functionality, making sure they're not damaged, that there's no cracks, anything with a spring or a screw, making sure that that's not backing out. And then, all right, checking these bars here for cleanliness, again, sharp edges, any kind of unwanted staining, and then placing it back. Make sure that you're matching that up to the count sheet properly. So I did check the numbers on there, but I wind up missing like a lettering at the end of the numbering, which was very important in the placement of these things in the container. So you see me going back and forth struggling with each one, trying to figure out how it goes in its place. And I'm like, let me check this count sheet real quick. So wind up finding that one of them had an XL at the end, same numbers, but it had an XL. So I was placing them incorrectly into the actual tray. So you'll see, nice and organized now. All right, guys, as always, stay true to yourselves, keep it 100, continue educating yourself, and until next time, peace.